Flint Community Webinar, your community resource. We're so happy to be with you today. And I want to start by first asking everyone to make sure they get to their destination safely. We know we have a winter storm that's coming our way. I've heard that it's supposed to start around 3, so we want to be really thoughtful about that. But let's get started. Right now, we've got a bunch of really great people here. We've got Dr. Latressa Gordon, Nurse T, Dr. Pierce, and Jim Malinowski. Let's get started with the Genesee Health Plan update and talking to Jim. It's so good to see you again today.
Happy New Year to you, and it's so good to be here and for us to start thinking right away in January about our health and how we can become healthier. So I'm going to talk a little bit about what Genesee Health Plan does, but mostly important, if you go to the next slide, I want to talk about a LEO Michigan Impact Grant. And you might think when you see Leo that we're going to talk about horoscope signs. I'm a Capricorn, but that's probably the extent of my knowledge of those. Leo stands for Michigan Department of Labor and Economic Opportunity. So there's a number of different departments in the state of Michigan, and that is indeed one of them. And so they had an opportunity starting in June to issue a request for proposal. And they were making $15 million in grants available to Michigan nonprofits. And the goal was to really lift, and we've been talking about this for years, and what are ways that we can lift people out of poverty. And they use, and a lot of other communities, and we're going to talk a little bit about this more, it's called the Asset Limited Income Constrained Employed, ALICE. And so there are a lot of communities who use this. Genesee, we haven't used that criteria as much, but I'll kind of explain it. And it's really mind-boggling when you look at some of that, how the living wage, we talk about that a lot, and how so many families in our area are struggling, and so many people trying to raise their children are struggling economically. So the goal of this grant was to help raise them. And what we're going to be focusing on is increasing people's healthcare coverage, making sure that that's helping them, having them use it, and also things that are barriers to obtaining good health. And there's so many of those things, just simple food, clothing, water, all those basic essentials. If we can't have those, or we have a hard time accessing those, then we're not going to be able to be healthier or even worry about healthcare insurance or healthcare coverage. So that's really the focus of the grant that was issued. And the state had gotten, and they're still trying to use their what we call ARPA, American Rescue Plan dollars, or they were the COVID relief dollars that were sent to the states. And really, this was an emphasis of this department to issue these grants. Next page. And so we are excited. I am very excited, and our staff is very excited that we were awarded $1.5 million for 2 years from December, and this just occurred, December of 2023 to December of 2025. So this is going to help in a number of different ways. It, first of all, is going to help expand current services to really all the corners, all the communities in our county, in Genesee County. Right now, we have a very extensive community health worker program. They are like our outreach arm. They are the ones who are out in the community where people are at, where people gather, where people go to for help or services. And they are in the community helping people, making sure that they have healthcare coverage, how to use that, what are their benefits, but also, are they hurting in other areas? Do they need assistance? Do they need to be connected to resources? And so we have a number of community health workers in the Flint Public Schools. We also have one that's based out of the Consumer Energy Payment Center. But we're really looking to expand that, solidify more places in Flint itself that we can reach, but then really looking at all those communities outside of Flint, Mount Morris and the Beecher area and Carmen Ainsworth and Flint Township and then even really those corner communities, Thedford Township and Montrose and Goodrich and all of those places and Fenton and Grand Blanc. There are poor people and people who are hurting and struggling everywhere. And so this will allow us to be able to reach more people, have boots on the ground staff that can assist and connect them to resources that we always discover. We think we do a good job of letting people know about our services, especially enrolling people into healthcare. But this will help us enroll more people into Medicaid and other state assistance programs. I always say there shouldn't be a child or adult in our communities in Genesee County that do not have health insurance. So Genesee Health Plan can help that. And then again, identifying, reducing, and removing barriers that residents are currently facing. And we all know that the economy is not good and people are really struggling to get by. I know in other webinars I've seen that housing was a topic, for instance, and housing is so expensive, and there's just so much that's hitting people. And so really, this kind of gives us an opportunity. If there are resources out there for these areas and issues, we can connect people to them. Next slide, please. So we talk about this ALICE, and so really ALICE again stands for Asset Limited Income Constrained Employed. So these are really folks who are working jobs that still are struggling. So they're employed, but yet probably their wages aren't high enough to support themselves and their family. And I think Heatherlynn's going to click on this link because I want to show people, especially if you are in the field or a researcher or there's a cool website here and it really shows this ALICE. So you can click on different counties and it gives you a message of what is the hourly wage needed per worker to support a family. And up above it says select state, select hourly wage, select family type. So you can do a family type of one. How much income is needed to support a household? Two adults, a family of two adults and a child, whatever that is. And so you can then and so let's do a family of two, or a family of four is fine. And let's go to Genesee County. I'm going to see if Heather. Oh, perfect. Heather knows where Genesee County is. That's great. And you can see in order to have a family of four, each adult would need to make $14.72 an hour, an hourly wage, in order to really have a livable wage that you can pay bills, you can sustain your household, buy food. So that's $29 in some sense an hour combined. And so, God, those jobs are difficult to find, and so that's the challenge. And so, this is a good tool for us to start thinking about. It used to be even just a few years ago. We were talking about when you talk as an organization. Well, I want to make sure my staff is making a good wage, and your threshold now, or you were targeting maybe $18 an hour, but that's not even a livable wage anymore. So we really, this ALICE is a good, useful tool for us to look at how do we lift people out of poverty, because they could be employed and they might even have healthcare benefits. Great. But they still don't have enough income to support their housing and all of those things. So, Heatherlyn, thank you for showing that. There's a link in the chat. But these are the folks that we are encouraged by this grant to help. And there's just so many people, you know them. They're the ones who drive a bus. They're the ones who work part-time jobs and work in food industry and in retail and all those jobs. And those are the people who really need our help more than anyone. So this grant, we were very fortunate that we were one of a few organizations across the state that got these dollars. And so you can see on the list that statewide there's different counties that were awarded this. And so whether they were food banks or works with children and family, a lot of different proposals. And I'm anxious. We're meeting with this group in next week, anxious to hear what their ideas are and what they're going to do in their communities, because I think we can always learn from that and be able to hear and see what they're going to be working on. And we always want to see results and so forth. So I'm looking forward to listening and hearing what these other grant programs are proposing to do. So, but we're very honored to be one of these communities and one of these projects that are going to be able to help a lot of people. Next slide. So just want to make sure everybody's familiar with what we do. So we do a number of different things, but we provide a basic healthcare coverage for Flint and Genesee County residents. So prior to Obamacare and the expansion of Medicaid and all of that, we've been around since 2001. And one of the biggest things we've done is we've covered it's close now to 100,000 people since 2001 on Genesee Health Plan. And it provides doctor visits, prescription drugs, cancer screenings and mammograms, outpatient mental health services, senior veterans dental. So if a veteran gets discharged from the military, they have to have an oral health condition in order for them to see a dentist or have dental coverage. And that's not a lot of this veterans. And seniors, there was just the open enrollment period into Medicare. And unless they pay for a supplemental for dental, they don't have any dental care either. And so we have two large populations in our community. So we want to make sure people have a dental coverage, labs and x-rays, case and care management. So really, other than inpatient hospitalization, emergency room services, the health plan really covers a lot of those things for kind of this population, this whole Alice population. Those are the people that we, over the last 22, almost 23 years now, have served and given a healthcare coverage to. Next slide, please. And so another big thing is that we provide enrollment into certainly the Genesee Health Plan, Healthy Michigan Plan. That's the name in our state for the expanded Medicaid program. Prior to 2014, only pregnant women, children, and the disabled qualified, maybe a few other little small populations, but qualified for Medicaid in our state. That changed. Michigan chose to expand Medicaid, get some federal dollars to do that. And so Healthy Michigan is what the state created. So we really expanded that in Genesee County. We have over 50, well, it's a little bit over 40,000 now. We were at about 50,000 prior to the end of the public health emergency, but now into the 40, but we have 40,000 people plus Medicaid. So Medicaid is just again covering children, adults. There should not be any children in our community that do not have health care coverage. Medicare. So we assist people during the open enrollment. And if you've ever seen the bombardment on TV of all these commercials and mailers to seniors, it can get very confusing. So our staff are all trained and certified to do that. Those are MiCHWA and Healthy Kids are those kids insurances. And then what we call Obamacare or Health Insurance Marketplace. And so if anybody loses their coverage, you might have worked for an employer, you lost your job, you got laid off. You can always enroll into that during a special enrollment period, or if your life circumstance changed, you got married, you got divorced, those are things that you can always enroll into. And so really the way to do this is to call us, and we make an appointment and see what you qualify for. When we have great partners like the Greater Flint Health Coalition, Hamilton also has staff that are trained to do enrollment in many of these plans. And then I think there's one more slide. And so we also, again, have these community health workers out in the field. We also have health navigation. So these are staff that we have, health educators and nurses, social workers that work with people on making sure that they're improving their health care and what needs do they have. And they work with the primary care physician on making sure that, we're communicating back and forth on what is the need and what medications are available. Multicultural system of care, we've talked about that in the past, and it mostly works with people where there's a language barrier or a cultural barrier to access care. Especially in our community, and you've had those speakers on in the past on the webinar that are in the Latino population, the Spanish speaking population. We have now two where we just got another person on staff that can provide a bilingual health navigation, go to doctor visits. It's really important for folks where there's a language barrier, that they can communicate effectively with their doctor, understand what they need, and then help them make appointments and so forth. Prescription assistance. There's a lot of medications out there that are not covered by health plans, or they might be in a price point or they're non-generic is what the term is, and so our staff are trained to find from the pharmaceutical companies opportunities for people to get those at no cost. And so we help them apply for that. Senior veterans dental, I talked about. And then women's health programs. There should not be any women who can't afford to go and get a mammogram or a pap smear, all those women's health issues. We can help identify those resources, high blood pressure, all that. So we have staff that specifically work with women and their health, and really help that population, because every day you hear, don't you, of people who have been identified with breast cancer, and if you can detect it early, you can get treatment right away and get through that. So that's all I had. I wanted to give a quick update, and I think I'm right on time here. Those are our contact numbers. Call us, visit us on Genesee Health Plan. Follow us on Facebook. You find out a lot of, we post very actively. We have a very active social media, and our staff does a real good job with that. And those links are all going to be put in the chat. So
Jim, you are always a fantastic partner. I really appreciate that you ended talking a little bit about women's health programs, in part because we are going to be spending some time today talking about cervical cancer and screening. And I do want us to be really thoughtful about the risk of breast cancer, the risk of cervical cancer, the risk of cancers and population and female population. So really important. And I'm really just impressed by the amount of resources that you're providing to people. I wondered if you talk a little bit, I mean, you aren't just healthcare, right? Like you all provide a bunch of resources for the community. Are there events that you have coming up that you wanted people to be aware of? I know sometimes you do some financial literacy stuff. And so anything you have coming up in the community, you all are such a wonderful resource.
yeah, so that's again, when we talked about this ALICE population and financial literacy, we have a great partner in Huntington Bank, and they are coming to our facility in February for 2 financial literacy classes. And I don't know if Shannon, you can put those there. They are. They're Thursday the 8th and Thursday the 15th at noon. We will feed you, and come, and we're going to talk about a couple topics. One is recovering from the holiday. A lot of us go into debt. We want to have a nice holiday, a nice Christmas with our families, and that has become very, very, very expensive. And so really focusing on that. And And then, yes, we also provide transportation. So if transportation is a barrier, we have a great partner with MTA, Mass Transportation Authority. They will pick you up for free and bring you back and forth to our building so that you can get to that class. And there's cool things. If you attend both classes, you will get a chance to enter into a drawing for a gift card. We just want to make sure people are supported, and those classes, we did them for the first time last year. Huntington did them at our facility, and they were very well received.
That is fantastic. You talked a little bit about transportation resources. Do you all do any connecting with transportation resources for people who are in Genesee Health Plan and might need some transportation resources to doctor's visits or
Yes.
labs?
So we are, again, one of the things that we do is get bus passes, either for the buses or for the rides to wellness. And so we work very closely with MTA, making sure people have those, they can get to appointments. One of the things that, we talk sometimes negatively about the state and about Medicaid and our Medicaid health plans, but they've done a really good job over the last 3 or 4 years for Medicaid recipients to get rides, and they've made it easier. A lot of people might not know that, and so we really want to make sure people can get to appointments. And sometimes those are hard to do if they're at last minute, but if you know you have a doctor's appointment and transportation is a barrier, or you need to get to the pharmacy or to the grocery store, MTA is a wonderful, and they're even evolving their technology so that they can do same day appointments. It's all digital, it's all GPS oriented. It is just amazing the improvements. We used to talk about this years ago that this is such a huge barrier. It was so difficult to arrange appointments. Now it's a lot easier.
Jim, I appreciate you mentioning that. I want to take some responsibility on us, and as providers, we got to make sure that we have opportunities for patients to be seen outside of their work hours, right? So it's always a hassle if you're trying to figure out the best time to get in to see your doctor or your provider if they don't have hours. So a push to all of you.
Exactly. So that's so important. And just, I always say this message, and I'm going to say it really quick, is that we want everybody to have a medical home. There are so many health challenges. We are still dealing with COVID and have a lot of questions about, and so it really is important to have a relationship with a primary care physician so that you can talk about healthcare, what to do, how, and so when the next crisis comes up in healthcare, we're ready. You already have an established link, and I can't emphasize that enough. And we've seen the benefit to those people who have a primary care relationship versus those who just use the ER or an urgent care. They just are not as healthy as those that have that relationship. So,
Jim, thank you so much for
all right.
coming on. Thank you. You are always a wonderful partner. So good to see you. Hey, stay safe and get home safely. Dr. Pierce, thank you so much for joining us. This is a perfect segue. We're talking about women's health services and the ways we get people connected with women's health services. And you're going to talk to us a little bit about cervical cancer.
Yep, thank you so much. It's such a pleasure to be here today. I really appreciate the opportunity. And there we go. Everyone can see my screen?
Yes, we can see your screen.
All right, perfect. So today I'm going to talk about cervical cancer prevention. And this is very timely because January is Cervical Cancer Awareness Month. I'm super happy to be a part of the Flint Community Cancer Consortium with many of you on the call, especially my wonderful colleagues at MSU. And also, I am the PI of MiCHWA, the Michigan Cancer and Research on the Environment study, which I'll talk about a little bit at the end if there's time. So let's just first talk about where the cervix is and who is at risk for getting cervical cancer. So cervical cancer, people who have a cervix are at risk, and that would include women and trans men. And I am going to, throughout the rest of my talk about women, but I am very cognizant that that also is including trans men in this dialogue as well. So the cervix is part of the female reproductive tract, and it's shown on this figure with big blue arrow. And I just want to highlight that really there are no symptoms associated with cervical cancer early on. And so that is why when we talk about prevention today, it's so important. Later in the course of cervical cancer, women will have symptoms of discharge and bleeding that are outside the norm for them, but really early on, there are not symptoms. So we do know that cervical cancer is caused by HPV. It's a necessary component of cervical cancer. And it also causes, HPV also causes other cancers, which we're not going to talk about today, but it's relevant when we think about prevention approaches. So the other cancers that HPV causes include throat cancer, so cancers at the back of the throat, the anus, the vulva, the penis, and the vagina. So HPV is really a major player in terms of cancer risk. So the human papillomavirus, or HPV, is very common. And so what I'm showing you here is that 8.5 out of every 10 people have had HPV. That's 85% of people, or 85 out of 100. Now, most people clear that infection on their own. It goes away and it doesn't necessarily cause any health problems, though there are, it does cause genital warts, some of the strains as well. But most people will clear the infection themselves, but not everyone. And that is why we really need to think about risk factors, particularly for cervical cancer. So we know that smoking increases your risk of cervical cancer twofold. So people who smoke are 2 times more likely to have cervical cancer compared to those who don't smoke. The other risk factors for cervical cancer are mainly around the number of sex partners, the age at which you become sexually active, and this is really broadly about exposure to opportunities to acquire HPV. That's broadly how those risk factors work. And then there is also a drug that was given to women decades ago to prevent pregnancy loss, DES, and people whose mothers received that are also at increased risk. So now let's just take a look at the frequency of cervical cancer around the world. And this is a map of the world, and the darker the blue, the higher the frequency of cervical cancer is in those countries. And so you can see that the burden of cervical cancer is really borne out in Africa, in South America, and Central America. When you look at the US, we're pretty low on the risk scale. And that's broadly because we do know how to prevent the disease. But that doesn't mean that there's no disease here, and that also the frequency of cervical cancer across Michigan varies, and it varies across populations. And so what I'm showing you here is a figure of cervical cancer rates across Michigan by region. And so Genesee County is in this region here, and you can see that it is not the lowest in Michigan. So there's definitely room to improve. And really, ultimately, because we can prevent cervical cancer, we'd like to see these rates get down even lower. And that's what I hope to talk about today. And I just want to highlight that both Hispanic and Black women are at increased risk of cervical cancer compared to white women. So Hispanic women have about a 25% increased risk, and Black women have about a 20% increased risk in Michigan. So this is Michigan specific data. So we really, as we think about our prevention strategies, how we reach people, this is something we want to keep in mind. So I've said this multiple times, it's amazing that we can prevent a cancer with a vaccine, and that's the HPV vaccine. So cervical cancer and other HPV-related cancers can be prevented with vaccination. And if we think about what that looks like, ideally, kids aged 9 to 12 would get the HPV vaccine. That's the ideal time to get the best immune response. I vaccinated my son at 9 years old, and that's what the recommendation is. But if someone has missed that window, there is vaccination recommended up to age 26. The dosing schedule changes a little bit in people who are 15 to 26, and then anybody who's over the age of 26 should discuss vaccination with their provider, because there are some cases in which it might be recommended. So just to really bring this home, HPV vaccination starting in kids age 11 to 12 could prevent over 90% of HPV-related cancers, and particularly cervical cancer, as that's the most common HPV-related cancer. So we really can prevent these cancers. And you only need 2 or 3 doses when you're young, and then you're protected. So that's a really, really amazing opportunity. So what does HPV vaccination look like in Michigan? So this is a map from the CDC of vaccination rates across the states. And you can see that Michigan is kind of right in the middle. We're the 28th highest state with a vaccination rate in 13 to 17-year-old people of 62.2%. So it's pretty good, but I could flip this around and say we have nearly 40% of the eligible people not vaccinated for HPV. This is a vaccination that can prevent cancer. So I want to just say, let's get those numbers up. And I think another important piece that we want to be thinking about is that this is across the whole state, and this is across all people in the state. And we know from national data that Black and brown communities are less likely to have HPV vaccination. So we really want to make sure that we are working toward pushing this up in our communities across Michigan, and specifically in Genesee County. And we already heard from Jim today about some of the amazing resources that are available. And so HPV vaccination is available nearby. The Genesee County Health Department offers appointments and walk-ins based on staffing. I've put the information here on where that takes place. It's about 10 minutes from the farmers market there in Flint. And they also have some satellite clinics that pop up, but that seems to vary by month. So this is the standard place. All right. We can also prevent cervical cancers through screening. And screening is a very, very important tool for cancer prevention. In cervical cancer, we are doing that through sampling the cervix. And this is done both to identify the presence of cancer, but also to identify the presence of pre-cancer lesions. And that allows us the opportunity to remove precancers before they even progress to cancer. So cervical cancer screening, like colon cancer screening, are really amazing because they identify the cancer and precancers. So this is an incredible opportunity. So cervical sampling is done for either Pap testing or HPV testing, or sometimes both. And this is recommended for people aged 21 to 65. And so I have on here all of the specific recommendations and the timing of those. And I'll just walk through that really quickly. So over here, it shows if you're under 21, then screening isn't recommended. And this is different from when I was a kiddo, decades ago. But now it is, it's recommended that you not start until you're 21. And so for young women aged 21 to 29, what's recommended is to have a Pap test every 3 years. And this is also different from when I was a kiddo, when the recommendation was to have it every year. And this is what's amazing: as more research is done, we can really do precision prevention, where we know based on age and the kind of test you're having, what's needed. So 21 to 29 every 3 years. If you're 30 to 65, then you can, if you have an HPV test, you only need screening every 5 years. So this really, over time, is such a lower burden. And I just, I think that if we can get that message out, we can see the screening rates go up. If you're over 65, then broadly you don't need screening, but there are a lot of nuances here. So anyone over 65 should be talking to their healthcare provider to determine whether or not screening is needed. But I really do want to emphasize that you still need to be screened even if you've been vaccinated against HPV. So vaccinations are awesome, but they aren't perfect. So we need to be diligent and make sure that we're taking all the steps to prevent this cancer. I mentioned that cervical cancer screening is really also screening for precancer lesions. And we know that around 5,600 precancers are detected through cervical screening in Michigan each year. So these are cancers that might, or precancers that might have gone on to develop into cervical cancer. And we just identify them and then take them out. It's important that if you screen positive, that you then follow up based on the recommendations of your provider. So what does cervical cancer screening look like in Michigan? So this graph is showing you the percent of Michiganders who are not getting cervical cancer screening as recommended. And this is the highest in the area that includes Genesee County. So that's somewhere between 20 and 24% of people in Genesee County not getting screened as recommended. So we do have some work to do there. Cervical cancer screening is available in Michigan really readily for people who are under and uninsured through this amazing program from the state of Michigan, and for those who are insured through your healthcare provider or these providers. They would just bill insurance. And this is the information for Genesee County, which I've got grayed out over here. You can call, you can email, and they are super responsive and quite happy to to take care of you. So January is Cervical Cancer Awareness Month, and I just want to really encourage you to get screened and get vaccinated. And so there's a question in the Q&A, and I see Jim has his.
Yeah, I want to thank you first, Dr. Pierce. This was like so phenomenal. Your overview from start to finish on how we get cervical cancer, how we can prevent it, and how we screen for it. Super, super thoughtful. It's really important as a PCP that I see patients who are informed and aware. Nothing more than I love that a patient comes in and is like, hey, should I get my cervical cancer screening, or what do I need? We've got expertise in the building. So I think, Jim, you've got your hand raised to help us out with this question, and I've got a couple thoughts too. So
yeah, I do have a couple of things. I love that presentation. And one thing is that if people need help connecting to that breast and cervical cancer screening program, Genesee Health Plan, we've been doing that for years, that we are the site to help people. So we have a staff person who can get those screenings covered at no charge for somebody. They work with a local radiology company to get that done, so people can just go here in the community. And so please that we put our number in there before to call us, and we can make sure that that person gets connected. So the other thing is your ears probably were burning, Lee, because I was having this conversation about HPV yesterday with Joanne Herman, who leads the efforts at the health department on immunizations, and we were talking about HPV and the low rate of vaccines. And how do we have that conversation in the office? When they, because you're talking about, probably sexual activity as one of the biggest causes. And so if you have your teenager in there and you're discussing this, probably as a parent, you're in a denial that your kid is having sex, or they're not going to freely admit that in front of a parent a lot of the time. So, even Dr. Edwards Johnson, how do we have that conversation so that we can get more of these vaccines done?
I'm going to dovetail that question, because one of the things I thought was really phenomenal is, Dr. Pierce, you mentioned that your son was vaccinated, and that may not necessarily connect to people immediately. We're talking about a disease that affects people with the cervix, right? And so feel free to talk a little bit about why it's important to have boys vaccinated as well. And then I'll talk, Dr. Harris and I can talk about the conversations we have in the office.
Yes, so, it's twofold, really. One is that boys are at risk for HPV-related cancers, but it's also designed to stop the spread of HPV, which will then benefit women as well. And so that, really, originally it was to vaccinate girls, and then I think some light bulbs went on, and it is now recommended for both men or boys and girls.
Thank you so much for that. And I think that's exactly how we get ahead of prevention, is we're thoughtful about the populations that might be affected. In the office, I only have honest conversations with my patients. So I'm having conversations. Earlier today, I explained high blood pressure from start to finish. And so it's the same thing in the office. I will often have conversations with parents first, because it's important to realize what parents are comfortable with and the level of conversation that they're prepared to support, right? So we have conversations in the office, but parents have to go home with these kids and explain, what vaccinations did I get? What does this mean? And so I start with some parent education. These are the vaccines that your child is due for today. These are the reasons. And, sometimes I have an 8-year-old girl. So sometimes it's a different conversation because she's the child of a healthcare person. So we're having some pretty robust conversations. But no matter what age your kid is, sometimes it's just distilling it down to what they can receive. We're giving you a vaccine to protect your lungs. We're giving you a vaccine to protect against the risk of cancers down the line. We're giving you a vaccine to protect against the risk of an infection in your brain in the case of meningitis vaccines, right? So we're really just sort of assessing the age and assessing the appropriateness of the conversation. But these are always in conjunction with the parents, because the parents are doing the hard work and the education at home. So I'm happy to hear what Dr. Harris does.
Yeah, I do a similar approach. I think most of the time when it comes to the HPV vaccine, I emphasize the cancer part as far as its prevention. I still remember when it became a big, well, I technically got the first piece of HPV vaccine when I was in college, and I wasn't the most informed, but they said it would prevent cancer. So I was like, okay, that sounds great. But I think now with us doing it at a younger age, the idea of cancer is obviously not something that the children are thinking about and the parents are thinking about, but we know that it's way more effective the younger people get it. And so I really try and have that conversation way before they're a teenager, potentially being sexually active. But I think educating people on how it is different from the other vaccines, because the other ones in some roundabout way may prevent some cancer, but this one specifically is cancer preventing. And it's actually cervical cancer screening is actually one of my well, it is my favorite screenings because it's the most effective, especially when you look at the numbers after the HPV vaccine came out, but even more specifically after the HPV testing came out, which is why we're talking about, when I talk to the parents or grandparents, like, yeah, when you were getting cervical cancer screenings, it was like every year. So people are excited about the idea that they don't have to get pap smears every single year. And then we add the idea that you could possibly space it out even more if you don't have HPV, which then this HPV vaccine will help you prevent you from getting HPV or help you clear it faster. It just all kind of connects I'm excited about it, but I hope that my patients get excited about the idea of being preventative, because no one wants cancer. No, the biggest things I hear people being afraid of is cancer and kidney disease. Like those things, when I say that, like it really unfortunately gets people really scared, but it also gets them motivated to do what they can to prevent things.
I love that you said that. And I think about myself, right? I love the art of being a physician, but as infrequently as I can have to go to the physician, I'm signing up for that option, right? So that whole pap smear going to 3 years and then 5 years was certainly something that I was happy to hear. There was another question in the chat about if you want screening more frequently. And I would like Jim's expertise here, but I want people to be thoughtful about having conversations with their providers about how often they really truly need screening. Cervical cancer screening is fantastic. It's the best screening we have. It is also for many people an uncomfortable screening exam to experience. And so I just want people thinking about what is necessary, and screening, every 6 months or screening more than you need to does not necessarily produce an outcome that is better than screening on the frequency that you need to. I believe there are some insurances out there that pay for differing frequencies. They might pay for every 2 years or every 3 years, and I'm going to defer to the expert on that. Jim, do you have any thoughts?
Yeah, I agree. You have to check. Unfortunately, it's part of the business now. You have to check and make sure that how often can you get screened through your healthcare coverage, unless you're willing to pay out of pocket for that. So that would probably be, if you're interested in more frequent testing than that, then I would certainly not only talk to your physician, but you're going to have to make that call to customer service at your healthcare coverage and see, is that going to be covered? So just kind of keep that in mind.
I'll add to that that there's a difference between screening and like working up something. And so we screen with the idea that someone is low risk for some cervical cancer or whatever the screening is. And so if someone has a cervical cancer screening one year And then another year they start having bleeding or some other abnormalities that makes us concerned for a cancer risk, then we're going to do a pap smear. We're going to check out the tissue and see what's going on. And so I don't want people to feel like, oh, because you're in between the screening window that we aren't going to fully work up everything, even if it's not purely for screening. There are other reasons to get a pap smear and get that evaluation. I'll also add that one of the reasons that the cervical cancer screening has been spread out is because of new technology, new information. We know about the HPV vaccine, we know about the HPV testing. And so because we know that cervical cancer changes happen slowly, we're able to space it out. If it was something that happened very quickly, then our guidelines would differ. But in that same context, that's why colon cancer screening has a 10-year gap if everything's normal. And so we know that colon cancer is a very slow growing cancer itself too. Unless you have other risk factors, there might be more frequency. But when we have this information, we're able to not put people through additional testing or additional procedures that actually may be more harmful based on false positive, false negatives, complications to that procedure. And so we don't want to add that to the list if it's not necessarily recommended.
And this is why you should get yourself a PCP like Dr. Harris, because she can give you all of that context. Dr. Pierce, I know you had a few MiCHWA updates, and I want to keep Dr. Harris. Don't go anywhere because I know you've got some updates too. But Dr. Pierce, if you had any other updates with MiCHWA, I wanted to make sure we heard them.
Sure. So I just want to tell everyone that we're so excited that we are now able to enroll anyone in MiCHWA between the ages of 18 to 49. It used to be 25 to 44, and now we've expanded the age down as well as up a little bit. So we had a lot of people between 18 and 24 who wanted to be a part of this study. So we're really excited that we can make that happen now. I also just briefly want to mention that we had to cancel our December webinar on water contamination and cancer risk with Dr. Rena Jones from the National Cancer Institute, but we will be getting that rescheduled for later this month, and we will push out the new invitation to everyone. So stay tuned for that.
I want to make the link that data and research and things like MiCHWA are what lead us to be able to do things like expand our cervical cancer screening guidelines, right? So it is this type of information that we're able to use to make decisions about things like, okay, do we need to bring women in the office every year for a cervical cancer screening, or do we have really good methodologies to screen and catch cancers early? So thank you for the work of your wonderful team, and thank you for all the work that you're doing, getting the word about awareness out and recruiting people to be thoughtful about next steps in cervical cancer prevention.
Thank you. It's such a pleasure to be here.
All right, Dr. Harris, thank you so much for taking a moment to talk to us a little bit. I know you've got a few updates you want to share with us.
Yes, no, I appreciate the opportunity to share. Like I said, cervical cancer is my favorite type of thing to talk about. But I just had a few updates. I know the webinar is going to end soon, but I wanted to recognize the announcement that happened on Wednesday regarding the Flint RX kids. And so for those who don't know, I'm sorry, my picture's blurred because I got off the internet. But for those who don't know, this is a first of its kind pilot program that the state of Michigan partnered with Flint regarding income disparities and income gaps, especially for those who are childbearing, having children, addressing kind of those risk factors and concerns during pregnancy. And so this is kind of a no strings attached opportunity for those who are pregnant this year to get a stipend of $1,500 during their pregnancy, and then $500 a month toward their baby and healthcare in their postpartum year. And so that's thousands of dollars for a household of a new or once again mother that's pregnant this year. And I really want people to, if you have friends, if you have clients, if you know someone who's pregnant this year, they should be pursuing this opportunity, because one, extra money is great, but also children have a lot of additional expenses that someone may or may not be prepared for. And so we really want this pilot program to be maximize and utilize, so that way it can stay and be an opportunity to support so many residents in our community.
I want to say, like, perennial shout out to Dr. Mona, because this is her brainchild, and the work that all of the community has done, that her teams have done. Shout out to my students who are doing some of the marketing for getting the word out about this project. It really is a community event, and it is only done through the support of the community. It is a wonderful program, and we're really, really excited that something like this is available to the people of Flint. It is phenomenal. So thank you for mentioning it.
Yeah, nope, I'm excited for it. I don't have a lot of pregnant patients, but this is really a great program that I want to get it to stay. So we need the pilot to be awesome.
Hey, Jim, you should make sure, I don't know how connected you are too with this, but your women's health programs this is definitely a connection that is welcome to community residents.
Oh, absolutely. We were just we talked about this program this week, and we're talking with our entire staff next Tuesday about getting the word out in the community. So our community health workers will be armed with this information in the Flint public schools, and I'm really excited about promoting this. So yeah, we're all over this.
Fantastic.
Great. The next things I wanted to just mention. So I started this series called Flint Doc Talks back in November, and the next one's going to be on January 31st, where I'm kind of going to do like a state of Flint health kind of address, where I'm really professionally, but also personally, going to be really honest with a lot of things that are impacting our health, whether it's the health disparities, the politics, the housing, the food, the environment, just kind of giving people a bigger picture of what I see as a primary care doctor impacting all facets of our lives before someone even sees their primary care doctor. So I invite everyone to stream it through my Harris Family Health website or come to the clinic on the 31st to check it out.
Thank you.
And then the last thing I want to mention is I'm doing a pilot program of emergency preparedness classes in February and March throughout, they're mostly in north side of Flint. But it's going to be a combination of teaching people CPR and basic first aid. It's not officially the certification, but I'm definitely a person who believes that everyone and anyone should know how to do CPR if you find someone down, because CPR out in our regular communities, homes, neighborhoods, schools, it saves lives a lot more effectively than someone who doesn't get CPR before they come to the hospital. And so that's a piece of that program, but also highlighting and educating people on emergency preparedness when it comes to environmental stuff. So this winter storm right now, those type of conversations of things that are impacting our homes and lives are going to be something I'm going to be talking about as far as being prepared and really just, I won't say surviving, but really knowing what to do when the world or community kind of throws a curveball, whether it's COVID related, whether it's tornado, whether it's a winter storm. This is a free food event. People will get emergency preparedness kits and emergency preparedness guide. And so I think it's going to be really awesome to sharpen everyone's skills, but also highlight some things they might not have known.
Absolutely. Dr. Harris, as we head into this winter storm, are there any tips that you plan to highlight in this course that are really easy for us to think about as we prepare to get ourselves home to safety and prepare for the next day ahead?
I would say the top 2 or 3 things that I tell people is, one, if you can stay home, stay home. Minimize your kind of out and aboutness. But if you do have to go out, getting there slowly is definitely better than not getting there at all. I also like to emphasize checking in on our elderly and disabled, because when these type of things happen, their services and resources are not as consistent or even coming at all. And so we need to check in on people when it's very cold. When we have these storms and the power might go out, we want to make sure that people have all things that they need. And if you have the ability to take someone in during a storm because you have just that space and the necessities, then I highly recommend it. So that's one less stress your family and friends have to worry about. And if you have to shovel some things, Small amounts is definitely better than trying to scoop it very quickly, because a lot of people do have strains, including heart attacks during this time of year, trying to just take care of their home. And we really want people to be safe and really listen to their bodies when things are happening.
Thank you so much for those wonderful tips. It looks like I've changed, like my camera has malfunctioned, but that does not matter. We are towards the end of our time. I want to thank everyone so much for their wonderful expertise. Big shouts out to everyone who was here: Jim, Dr. Pierce, Dr. Harris. A reminder about CEUs for community health workers. Please get to your destination safely, and we will see you next month.